Sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course where we do encourage you to call in to join in. Today, a newly acquired guest of ours. I got a feeling you're going to be interested in her conversation, her expertise. Well, her real expertise is as a board-certified pediatrician. Working with kids as she has her entire life, she now devotes a lot of her attention to nasal washings. Well, you've certainly heard of it. I don't know if we've ever done it, but it turns out there's quite a case to be made for well, here's how she describes it. Everyone over the age of 2 should be washing their, here's the catchy word, personal filter daily to reduce allergic reaction and reduce risk for coughs, colds, and the like. Your personal filter, you need to clean it. Use saline solution to do it. How to do it? Well, she says, so safe, so simple, even a 3-year-old can. And we're going to learn how our 30 and up year olds may want to take her up on her expertise today. Her name is Dr. Hana Solomon. She likes to be called Dr. Hana. I know that because I just called her a moment ago, and that's how she answers the phone. She's Dr. Hana. She'll be with us and our special guest today throughout the entire hour. If in the course of our discussion with Dr. Hana today, you want to call in to ask a question or to make a comment, the number, as always, will be 412-825-6262. That's 412-825-6262. Dr. Hana will be with us today. Now, coming up with, I want to re-mention again, things are clicking away for the Navarro family. Want to bring you up to date on that website. Go to it frequently. Things keep changing all the time. You'll find our link there, by the way. We're on the website. The website called cancerbusters.us is a site generated and initiated by Jim Navarro, father of now deceased young Thomas Navarro. He died back in November 19th of 2001. His entire medical debacle, as well as the saga for the entire family, is now to be portrayed on a documentary. It's going to be at, and The Voice told us about what is it called? Mill Valley Film Festival. Evidently, it's big doings out in the West Coast. She tells me we can see Alcatraz off into the distance. Anyway, from October 7th to October 17th, we're going to have that movie launched. I'm try to see if we can get a screening of it here in Pittsburgh, actually. That's because it was mentioned by Faith. I think that would be a good request. Anyway, keep up to speed, keep up to date on that documentary. The ultimate endpoint for all this is to rehope and to reintroduce the Thomas Navarro Patients' Rights Act into Congress once again. It had its first go-around a while back. Never did get through much. Hopefully, after people see the documentary, this should strum up some pretty large feelings of anxiety and anger about this salient point that this family learned on their own, which many of you maybe didn't know, but I think you're now becoming aware once again, is when it comes to your children. When it comes to you, yes, as an adult, you're allowed to make decisions with respect to your own health and how you want to be treated, and that can fly in the face of the conventional medical model, or or can be in harmony with it. But when it comes to children, your own children, you do not have that right. And consequently, based on what this family went through, trying to avoid chemotherapy and radiation therapy, which was handed to them as the only choice they had, they fled. They moved throughout this entire country back in just the turn of the year 2000, trying to get away from the omnipresent government and the conventional medical community. This led them on quite a trip involving many stops, meeting many politicians. Well, I don't want to dredge up the entire thing, just to tell you we're moving toward that launching, previewing, original showing of the entitlement of the documentary is well, you get the message: cut, poison, and burn, and you can take it from there. Okay. Also, Jimmy Roberts enjoyed. Well, we enjoyed being with him. Hope those of you who are having difficulty with atrial fibrillation, as well as being placed on a Coumadin regime, a blood thinner, a pretty potent one, and one that's fraught with all sorts of problems. Your doctors are doing what they're supposed to do. They're trying to protect you from developing clots. But it turns out we have something called a CHAD system to evaluate your risk. It is extremely minimal if you do nothing. If you take no Coumadin at all, 1% chance of having a cardiac event. If you did nothing, if you do something, and the something appears to be pretty widely recommended by both doctors Stephen Sinatra and James Roberts, which is a regime of fish oils, as well as one of the kinases. These are nattokinase and lumbar kinase. I refer you to the book, Reverse Heart Disease Now, prominently displayed on my desk, and there's a large section in the book devoted to those on Coumadin wishing to get off. This is a big request of patients of mine. They continue to come in once that they're placed on a Coumadin regime, and they're very anxious about being on the regime, and they've been scared to death by their doctors, thinking that they have no choice. This must happen. And admittedly, over the age of 70 to 80, bringing in additional health problems, the risk goes up considerably. They say 8% having cardiac events. That's now significant. By the way, that's if you did nothing. Even in that population, if you did something, we believe that number is very much diminished. But that can be your own choice. If given a proper protocol, we can talk about it here. Come on in to see us. We're at 3075 Washington Road, south of the South Hills Village on Route 19. That's called Washington Road, folks. Come on in to see us. Set an appointment by giving us a call at 724-942-3002. Now, that's about rounds all that up. We're scheduling guests as we speak for the month of September because, hey, folks, I don't know about you, but my little guys, I call them little guys now, at 11 and 13, they went to school today. Yours should be in school too, and I know, no fair if you have a smile on your face, as I do on mine. They are off for the 2010-2011 school year. Okay, let's do this. Let's take a short break, and we're going to get with our good friend, newly acquired, Dr. Hana F. Solomon. She prefers to be called Dr. Hana. Her message, a strong one, an interesting one. She says, safe and simple. Even a 3-year-old can do it. What is it? Nasal washings every day. We're going to find out from her about how she feels about it and why she feels that way. When we return, we'll be back with Dr. Hana P. Solomon.
This is pretty straightforward. There's really hard to review about how best to manage yourself. It's no wonder. It seems that every time you turn on the television and radio, another expert gives another suggestion for you to follow. It seems to be reasonable enough, no matter how differently you follow the instruction, it it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Want to help your family eat healthier? Instead of learning to disguise soul food wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation and work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this Monday version of the show. We open up the last couple of days of the month of August. Mine went back to school. Hey, are yours in school too? Speaking of kids and big kids, little kids, all size kids, this is that time of the year when allergies befall us. High pollen contamination out there, and a clinician who's seen those kinds of disorders pass by her purview over a career says, hey, there's a way of handling it. Wash that filter of yours. We're going to find out about the filter and the person that says to wash it. Her name is Dr. Hana T. Solomon. She's with us today. Let's say good morning and welcome to her. Good morning, Dr. Hana.
Welcome, and thank you for having me, and I appreciate it. Good morning.
Well, I'm so pleased to have you on the show, Doctor. It is, as your literature mentions, that time of year. Kids are going back to school, but it's a high allergy season, is it not? And I'm real interested. Well, let's just take you as a clinician and a pediatrician. Give us a little bit about your background. You've been doing this kind of work for a lot of years. You're not a rookie. You've seen a lot in your time, and it's moved you toward espousing and embracing a pretty interesting way of handling some pretty contentious problems. Talk to us about your career and how you stumbled across this and whether it was a stumble or not.
Well, the short version is I went to med school as an adult after living on a spiritual commune for 4 years. And there, of course, I was exposed to the importance of nature and natural. And I grew my own soybeans and such. But I realized I couldn't change the world growing green beans. And decided I needed to go to medical school so I could help empower myself more. And so I did. I was blessed to come across a wonderful ear, nose, and throat surgeon specific for children. And he said to me, if I could get everybody to wash their nose, I'd never do surgery again. Well, fast forward, and I opened a practice with my husband in a mom-and-pop clinic. And then I realized, because I'm a pediatrician, that I've become the snot-nose expert. And the regular way, the formal way to treat all those snotty noses was with drugs. But because I wanted to treat my patients like I would treat my own child, I wasn't quick to get the prescription pad. And so I really looked for alternatives, looking at foods and environments and what can we do to prevent these, and of course the neti pot. was what I used at first. I did a lot of looking into the research. I really picked my patients' brains when they came back. I'd listened to what worked and what didn't work. And then I decided that the neti pot was a really good idea. It's been used by Buddhist monks forever. But most humans have a difficult time, especially 2-year-olds, especially teenagers, especially me, especially the elderly. There's a long list of folks who cannot use the neti pot. In case any of your audience doesn't.
Well, what is that neti? Is it a neti pot?
N-E-T-I. And that is, it looks like an Aladdin lamp or a little teapot.
Okay.
And it's an ancient device, and you fill it with salt water, and then you put the tip into one nostril, and you bend your head over, you twist your neck, and you do these contortions, and you actually flush the liquid in the neti pot through your sinuses.
So
it's a little bit difficult.
It is difficult, you say, huh? I never had heard of the term before. And
oh, you don't watch Oprah?
Oh, no, I don't. As a matter of fact, I don't.
The reason I say that is when I first introduced it, most people said, "You want me to do what? And how?" They thought I was crazy. But what was interesting, and then I developed my own system called Nasal Pure, which is comfortable and convenient. You only make the mix once a week. And it's actually very effective. We could talk about the details of that later, but you asked me for a background, and so we went from natural med school, the neti pot, or the idea of nose washing, and then developing my own product. I've recently written a book for the end consumer called Clearing the Air, One Nose at a Time, because I have found that it's the end consumer who will actually hear my message, which is prevention, education, and avoidance of places, rather than lecturing to physicians. I do lecture to physicians, but often they're asleep at the wheel.
Huh. That's a kind way of putting it. Let's talk about how asleep they are. Look, you practice, I'm guessing, for maybe a while, or maybe you never did, following the protocols.
Practice for 20 years.
Practice for 20 years. But you were taught certain protocols in your training program. They didn't tell you to grab the saline. They were talking about grabbing that prescription pad. And then you came across a whole host of kids, that didn't respond to those drugs? Or you just never even use it from the get-go?
No, I never used them at the get-go.
Ah.
Of course I would if I had to. If I absolutely had to. But it wasn't the first line of treatment because, we all took an oath. First, do no harm. And I knew that antibiotics are harmful, nasal steroids are harmful, antihistamines are harmful, the list could go on and on. And so I very early, I think the issue or the fact is that because I was older when I went to medical school, my brain was awake from my previous experiences, and I did some advice, but the things that made no common sense to me, well, I certainly was able to pass the test with flying colors, but I wouldn't incorporate those protocols into my practice.
So,
for example,
go ahead.
Immunization, but we won't go there.
Oh, you're allowed to go there. My listeners would love to hear what a pediatrician for your stature might feel about immunizations. Please go ahead.
Well, it's a very long discussion, but I think the general message is, and I say this about every topic, when a family comes to me, it is my job, they hire me for my knowledge. It is my job to share with them what I've learned in the book, what I've learned through clinical experiences, and then they tell me how they feel about particular things, what their beliefs are, and then together as a team we come to we figure out a plan that works for everybody. And so I think saying all immunizations are good or all immunizations are bad is a fallacy. And that's where it's a very long discussion if we want to discuss each vaccine. But let's just discuss one. Can you take one that I'm for or against? Let's take one that I was against.
Go ahead. Which one's that?
Rotavirus for infants. Maybe a lot of folks are not familiar with it. It didn't have a long life. But the general idea, in my mind, is it came out, I'm going to guess, 10 or 12 years ago, maybe 15 years ago. And it's for infants, and it's supposed to prevent rotavirus diarrhea.
Yes.
And it can really cause havoc and harm and even death to some children, severe diarrhea. But it came out, and it was I looked at all the studies that were done on it, and I told my parents, it's pretty new. There's not much literature on it. These are the risks. We don't really know the long-term effects. Why is your child at risk of getting this disease? Are they in daycare? Well, can we pull them out? Are they at a daycare that just needs to up their standard in terms of hygiene? Are they not on breast milk? So we look at their environment and what their risk is, the risk of the shot, and then decide. If they decided to get the shot, they'd have to go to somewhere else. I didn't carry it. I don't believe in carrying the shot if they're new. And lo and behold, 6, 8, 9, 12 months later, they took it off the market. I think too many drugs. Once there was enough data to show that there was a significant number of children that were dying from rotavirus vaccine. So there's an example of you have to do your own research. You have to ask questions to the patient, the family, and go from there. Hello?
All right, I'm here. I'm listening to you. Okay, so that particular vaccine is one that you knew early on because of its newness. We could really get into discussion. Maybe we'll do that another time, talking about the old ones too.
Yeah,
I got to. Yeah, I really would want to have that discussion with a pediatrician such as yourself. But down as you begin your practice, you say you never really worried about being conflicted with what you were taught as a protocol, using drugs versus that surgeon coming to you and telling you, you know what, Dr. Hana, if I could just get people to wash their noses every day, I'd be a poor man. And you picked up on that. So where did it take you next?
Well, I gave recipes out, different devices. I think the important thing that I did was I asked the question to my patients and the parents, did you wash? How did it go? What felt good? What didn't feel good? Why? And I picked their brain every single visit, every single person that I recommended it to. And within a few years, it was clear to me that the devices available for washing were not convenient and not comfortable enough. And it was clear to me that we humans, and maybe especially Americans, I don't know, but we humans tend to do things when they're convenient and comfortable. Example, if you're flossing and you wind up having bloody gums, you're not going to floss for a long time. And then you'll floss right before you go to the dentist. But if you have developed your flossing technique to be comfortable, then it's a no-brainer. You do it every day real quick, you're done. So it's a cycle. And then I also spent a lot of time looking at the research of nasal irrigation. And when I first started, there was only a few papers. But as my mind was open to it, there were more and more and more coming along. And the research shows a buffered hypertonic saline is incredibly safe and effective. In fact, a buffered hypertonic saline, and the hypertonic means super saturated salty. Buffered means it won't burn. It has a buffering agent in it like sodium bicarb. So A 2-to-1 salt mixture has been shown, without a doubt, to remove 80% of the allergen. What that means is if someone has allergies, seasonal allergies, and they wash their nose after they come in from outdoors, they remove 80% of the allergens. What's important about 80% is that our bodies are wonderful machines when treated appropriately. And we can tolerate a certain amount of a toxic load. That is pollution, a little bit of allergen, a little bit of debris, a little bit of excess mucus. But if you tip us over the edge, then we get sick. Then we get symptomatic. So washing 80% is fabulous. The other thing is hypertonic saline has been shown to thin, thick, sticky secretions which plug up the pipe. And when we make about a pint to a quart of mucus a day, which is a wonderful thing. Mucus is nice and good and very protective. In my chapter in the book, it's called The Magic of Mucus, because it is magical. But the key is we have to keep it thin and flowing. And hypertonic saline will take that thick, sticky and turn it into thin and watery so it'll drain out.
Uh-huh.
Also hypertonic, based on scientific studies, actually based on my professor's studies, who really is a world-renowned ear, nose, and throat surgeon. He showed that the little hairs in the nose, the cilia, they work better and faster, 17% faster, if hypertonic saline is flushed by those little hairs. And it makes sense. If you imagine the inside of your nose and it has the little hairs that collect the mucus sort of traps the pollution, and if it's all flowing, then you will swallow it or spit it out and you'll get rid of it on a daily basis. If you flush it, clean it with hypertonic saline, those little hairs, now if you imagine a broom being clogged with glue, the broom cannot work anymore. But if you wash and thin that mucus, now the broom is able to sweep the garbage out.
Very good way of explaining it. And so now your experience of all these years and perfecting this technique and looking at your patient population, how effective is this nasal rinsing with respect to allergies as well as maybe colds and flus and everything else? Because I got a feeling you use this for everything.
Well, brush your teeth every day.
I do, yeah.
Because you want to have healthy teeth for a lifetime. Well, the nose is your filter. You know, the nose not just filters the air we breathe, but humidifies and warms the air we breathe. And if you don't take care of that filter, you will get sick. Let me give you an example. Your nose is stuffed for whatever reason. You're out in the garden, or you're on a bike ride, or you just got a little cold. So what's going to happen? Your nose gets all plugged up, and then you breathe through your mouth. You have to breathe. And when you breathe through your mouth, you have unfiltered, unwarmed, and unmoisturized air, and then you have problems in your bronchial tubes in your lungs. Sometimes asthma is a great example of that. You know, asthma is swollen, congested tube, just like your nose becomes swollen and congested. It's exactly the same process. It's just lower down. So, yeah, washing your nose on a daily basis prevents. And there are so many studies that support that. There's a recent study about 2 years ago in Czechoslovakia. Lots of kids, they all had allergies of a certain type during a certain season. And during that season, the children washed their nose. The ones that washed their nose with them, too. The ones that washed their nose used less allergy medicine, had fewer follow-up visits with the doctor. Maybe the most important is they had fewer secondary bacterial infections of the sinuses, the ears, and the lungs, just by washing. A chapter in my book is called as the nose goes, the ears follow. There is a recent study, I mentioned that already, that kids who wash their nose on a regular basis had no ear infection. There's another study with people who have bacterial sinus infection. There's documented bacteria in the sinuses, overflooded. The folks who wash their nose regularly, as compared to the folks who didn't, 3 weeks into it, the folks who washed their nose, 80% of them were perfect, as compared to the folks on antibiotics, who we know, first of all, they had to pay for the antibiotics, and they had to deal with the side effects of the antibiotics. They had to change their natural immunity, hence yeast infections and diarrhea, potential hypersensitivity. But maybe the most important is those folks now have a higher chance of developing a bacterial resistance, but also a fungal infection in the sinuses, which is a really tough thing to treat. We know that folks who have recurrent sinus infections go to the doctor, and what does the doctor have to offer? Surgery. So you do surgery, which is one of the hardest, really the most difficult surgeries to get over. I know someone, a physician, who actually lost his one of his eyes, sight, lost vision in one eye from his sinus surgery. They're not easy.
Oh boy.
And many folks who have sinus surgery 5 years into it have to have another surgery. So, cutting for a problem that has to do with what you breathe in doesn't make sense.
Let me ask you this. Your experience has been so much with kids.
And my husband is a family practice doctor.
Oh, because that's the point I wanted to ask. Maybe because he might be doing the same or similar things with the bigger folks. Are you finding that this is just as beneficial to the olders and elders, or is it just with kids? And my guess is maybe it's universal, but what's the experience?
Yeah. Well, speaking about folks over 40, which I definitely am, folks over 40 develop thicker mucus anyway because of our hormones. Folks over 40 often take other medications like blood pressure. That dries your mucus. And there's changes that happen inside your nose as you get older as well. So the senior schnoz, what I call it, has more problems than the 20 to 40-year-olds. And those folks often are the ones that are wearing CPAP machines and snoring. Washing on a regular basis is incredibly helpful. I hear it all the time. Let me give you some examples. If you're snoring and you don't have a CPAP machine, which is a machine you put over your nose and mouth during the night that helps remind you to breathe.
Now, there's some real contraptions there, aren't they?
They are. Now, some folks actually need that because otherwise they will have a stroke in the middle of the night, or there are some issues there. But there's lots of folks who are prescribed a CPAP machine that do not have true sleep apnea, which means they actually stop breathing for more than 20 seconds. And you can't really test somebody if they're congested they've been congested for months. They go to the doctor and say, I'm snoring, and then they do a sleep study. If you're very congested, you have a false result. And so I have found a lot of folks avoid the need for CPAP if they wash their nose on a regular basis, get all that junk out, and then go back and see if they're really snoring. But the folks who do need a CPAP, when you wake up in the morning, you're really dry. Even if it's a moisturized, there's some CPAP machines that moisturize, they are still drying. And so washing when you wake up is helpful. More importantly, if your nose is not open before you go to bed, you can't use that.
Wow, so you may have to wash before bed, too.
You wash before then. Also, how many of us know people who do
all day?
Clearing of the throat is almost always in folks over 40, and that is the mucus. I always assimilate to, we all know of 2-year-olds who have mucus coming out the front of the nose. Well, as we get older, it tends to drip down the back. As we get older, it gets thicker and drier. So that sound is someone trying to clear that mucus, but it's so sticky that it won't move one way or the other. So they're washing your nose helps that. Washing also helps for folks who have a decreased sense of smell because they've been congested for such a long time.
So, come small sizes or big sizes or real large sizes, this is pretty much a universal plus for everybody, even if they have serious problems. You mentioned the CPAP people. I mean, that's an area. Yeah, or nasal polyps, which surgically usually have to be removed. But what if that tissue, if it's just kept clean and the mucus made less thick? How much benefit can one get to actually maybe even avoid that kind of surgery, which I think was the message you were trying to bring home. Avoid that surgery if possible.
Yeah. Polyps, I have a chapter in my book about the polyps. Polyps are benign growth inside your nasal cavity, sometimes in your sinuses, but mostly in the nasal cavity. And it looks like a grape or teardrop shape. So it has a huge mass to it, but a tiny little root that allows it to hang or grow from the tissue. Once you develop, well, there's several types of polyps. One is familial, which it runs in families. And those need to be kept clean and as small as possible because they'll start plugging up the work. Most people get polyps from chronic irritation. If you have a lifetime of allergies, there's a good chance that you're going to have a polyp or two. In general, doctors should not surgically remove polyps unless it's blocking an airway because it'll grow back. It will grow back because the root, it's like a tree with very, very deep roots. And the surgeon can cut the branch off or even the trunk off, but it's very difficult to get to the root. So there's a good chance it will come back. So, in life, everything is risk-benefit, like the stock, risk-benefit. And in my humble opinion, let's see, how risky is it to wash your nose on a regular basis for a few weeks and see how you feel versus signing up with the anesthesiologist and the surgeon to do surgery? Risk-benefit. Let's see. What should I do?
Well, which one should I do? You're a smooth talker, Dr. Hana. I imagine you convinced a lot of people to give this a try.
Well, what I say is, and I'll say it to your listeners, if you don't love it, they give you your money back. Why? Because I truly believe that most folks don't initially try it because they think they're going to have the sensation of somebody pushing them into the swimming pool or drowning. And that is not the case with my system because, as I said, I'm a water wimp. I hate the feeling of water in my nose. I don't ask my patients to do something that I would not do. So I actually give 100% guarantee. And sometimes I joke about I'll come to your town and buy you a steak dinner or a bean burrito, whatever, if you're vegetarian or not. And I've never traveled to buy somebody a meal.
Wow. Let's do this. Because you say this is so simple, even a 3-year-old can do it.
2-year-old.
2-year-old. Okay, you've adjusted.
And actually on my video, on my website, you can say, see an 18-month-old do it.
Well, let's hear about how the inventor can instruct us what kind of visual picture can you create. We're going to find out about your website. Want to find out about your book. Can we take a short break, come back, and get to the how-tos and where-tos when we return?
Thank you.
Okay, you're with Dr. Hana. You know she knows what she's talking about, don't you? Be back in a moment. Find out more.
Honey, just got the word. The company's new health plan has $5,000
how we doing?
deductible. We have to make sure nobody gets sick this year. Remember what
I'm
those
having
doctors
fun. I hope you
called
are.
from last year's colds and flu? Oh, sorry. I've got to go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit. Fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruit with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the spirit is unique whole fruit puree. Fruit of the spirit contains fresh fruit native to the Holy Land and hydrolyzing minerals from the Dead Sea with no added sugars. Fruit of the spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Here in this Monday morning version of the show, learning about, well, how to wash that filter of yours by someone who really ought to know. She says only a 2-year-old now. 2-year-old can do it, and do it quite easily. We're talking about nasal washings with an expert pediatrician, board-certified Hana R. Solomon requires that we call her Dr. Hana. She's very comfortable with that. Dr. Hana's with us today. You with us again, Dr. Hana? You back there?
I am, and thank you.
Look, could you please, so that we don't miss this, take a moment or two, talk a bit about that book. I think the name of the book, Clearing the Air One Nose at a Time. You got away with words, Dr. Hana. The book, the nasal washing videos, the Naso Pure concept. How do our listeners find out more and get involved more with this concept?
Well, they could either go to my website, nasopure.com, NASOPURE.com. There's phone numbers, there's videos, there's a lot of information there.
What's the phone number? Because we may have some people out there that don't have computer access.
And that's where I'm going next, and that is 877-853-7873.
All right.
That's 877-853-PURE.
Okay.
The other thing is they can always call my cell number.
Oh, there's a pediatrician for you. Go, giving it to the world.
573-999-0450. And I can be available as soon as you and I hang up.
Wow, there's an invite, folks. A doctor allowing you to call her on her personal cell phone. Once again, that number 573-999-0450. You have
my personal cell phone is on my product. It's in my book. I really feel that information is the way that we help people, and there's nothing like human contact.
Boy,
So
you back in.
It's not unusual that I'm giving out my cell number. It's on everything I say.
Very good words to be spoken, doctor. Certainly give people who are listening to you the confidence that you really care and you'll answer their phone call and their questions at any time.
Here's the deal. I don't care what system you use. You can use a garden hose or a turkey baster or a neti pot. I don't care what you use. Just find a system that works for you and begin to wash your nose. I feel like I'm a little bit like the inventor of the toothbrush, where it was a new concept. This is, although it's an ancient technique, in most of the world, most of the folks on the planet who have no money use salt water. Everybody remembers their grandma telling them to sniff salt water. And one of my logos for my product is developed by the nutrition using the mother's wisdom. It is a simple idea of how to take care of your children.
All right. So if it's so easy, could you give us a visual description of how it is that you're supposed to do? Because I got a feeling what you mentioned a moment ago about this sensation that I'm going to be drowning, and you say, no, absolutely that won't happen. How does one utilize your product to do the washing and not have that sensation, so much so that you can get a 3-year-old or a 2-year-old to do it?
Yeah. Thank you for the opportunity. That's why I wrote the book, because in my book there's simple diagrams that I drew showing the anatomy. And let's talk about the maxillary sinuses, which are the ones right under your eyes on either side of your nose, the most commonly ones that are affected. That is a bony cavity that is surrounded by bone. It's an empty cavity surrounded by bone, except for a tiny little opening way up high. So imagine you're in a cave with a tiny window, less than 1/4 of an inch in diameter in an adult, and that's without any swelling. And that quart of mucus a day gets manufactured and exits that little hole. Most of the washing systems flood the sinuses, and that's what gives you the drowning feeling. With Nasal Cure, the bottle is shaped in a special way. It has a crook in the neck of the bottle. You hold it upright, and it flushes along the nasal floor in the same pathway as the air that we breathe. You hold your breath, which blocks the back of your throat, so none of it goes down your throat or in your mouth.
Okay.
So you hold your breath. Takes 1 second. It flushes along the nasal floor, and because of a physics principle called Bernoulli's principle, and this is also written in the book, and you can trust me on this, it causes a negative pressure at the sinus opening, and it suctions the sinuses out. It suctions the inner ear tube. The inner ear tube, the station tube, actually drains into the back of your throat. And so Nasal Cure flushes the nasal membrane clean, and at the same time causes a very mild vacuuming of your sinuses.
So now, is this water, once you've squeezed, it going to be coming back out the nose, or is it going to go back into the throat?
All of it exits the opposite nostril.
The opposite nostril.
So you could actually see large volumes of mucus come out if you're congested. And so on my website, nasocure.com, there's many videos. I'm a visual person, and if somebody doesn't have a computer, the book shows, it really just educates folks about nasal washing in general. There's a tiny chapter in the book, 52 pages, about Nasal Cure in particular, but the rest of the book never mentions Nasal Cure. It educates the consumer about how to take care of their personal filter.
Exits at the opposite nostril. Very good. And so, imagining,
When I give lectures, when I give public lectures, I always have somebody from the audience who's never washed volunteer, and they come up, and they do it the first time. And they're always amazed with how easy it was. And I usually pick the person who's most afraid, if they're willing to try it. And I've never met a person who couldn't do it. Now, you said children versus adults. What's interesting, what I have found that's universal, it's an easy thing to teach a child because they don't have preconceived notions. They don't have the experiences of being a 10-year-old pushed into a pool. They don't have experiences of pain associated with their nose. So washing a child is scary. It's getting adults to give it a chance, give it a try. That's my hurdle.
Now, on a squeeze, because you did say a squeeze, how much, what is the volume of saline that's moving, or is this variable depending on who squeezes it?
That's right. It's variable. I recommend 1 ounce each nostril. It's just one squeeze. Some stuff comes out. There's some folks, like my husband, who likes the feeling of a lot, and so he'll use 3 or 4 ounces. But the cool thing about my product, you don't have to make your mix every day. You make your mix once a week in your 8-ounce bottle. There's no preservative in it. It sits in the shower. When you wash your body, you pick up the bottle, you put it in position in your nose, hold your breath, squeeze one side, squeeze the other side, north, both nostrils outward. You get rid of the junk, and you're done. I also have a small bottle for children or for travelers or for athletes. So there's a 4-ounce bottle and an 8-ounce bottle. And because it's plastic, any educated listener will ask me, is it a safe plastic? And it is. It's EPA-free.
Very, very good.
And this product is made in Missouri. And it is assembled by disabled adults in Missouri.
You just got about every bit of seal approval on this thing you could imagine, made by disabled adults. You mentioned athletes. Hey, how effective in athletes would this be? Because they got more.
A professional football. There's a professional football player, Chase Daniel. He's worked for the University of Missouri Tigers football team, and now he's on, I don't know which professional football. But they're not allowed to use drugs, obviously. And a lot of athletes, 60% of adults have some form of allergy. Washing your nose will help you avoid the need for any decongestant, antihistamine, or nasal spray. When your nose is congested for any reason, when you use a drug, let's say a nasal steroid, what are you doing with that steroid? This $100 bottle for 1 ounce of steroids. Well, you're putting the drug on top of mucus and on top of swelling. It's akin to having a dirty cut on your knee, and you're putting the antibiotic on top of the mud. And I propose that you wash the mud, and you won't need an antibiotic. You won't need that nasal steroid because your body will be able to deal with it. If you eat healthy, you will be able to deal with these issues. So I'm not saying washing your nose will make you young and rich, but I think that washing your nose will definitely improve your ability to smell. You will reduce the number of medications you need. It will prevent symptoms. We haven't talked about cold and flu season.
Go ahead. We're going to be entering into another month or so.
That's right. The Centers for Disease Control talks about washing your hands. Okay, that makes sense. They talk about coughing into the crook of your elbow. Okay, you don't spread the germs because when you cough or sneeze, it spreads to 6 feet. And then they talk about using antiviral medications for prevention, or if you've been exposed, Tamiflu or whatever the drug is. Well, doesn't it make sense to wash the filter? We know that hypertonic saline will kill the germs. You add enough salt to any living organism and it will die. So I propose, and there are studies that show that folks that wash, there's a study with college students, totally healthy, all the kids, split into groups. The kids who wash their nose during the winter season had fewer colds. Well, that makes sense. Why? It's not rocket science. And if you do have a cold already, you know that after you have a cold, there's a good chance you may get a secondary bacterial infection in your sinuses or ears or whatever. We know that if you wash your nose, you reduce the risk of secondary infection. And what my patients have told me over and over again is, well, I didn't use it, but when I got a cold, I started using it, and I was over that cold in 2 or 3 days. When people travel, airplanes, 20-30% of them get sick within a few days.
Yes.
If you wash your nose when you get off the plane, you'll avoid that hazard. You know, we didn't talk about pregnancy. During pregnancy, 30 or 40% of pregnant women get what's called pregnancy rhinitis, which is congestion in the nose because of increased blood flow. The only treatment that's safe is a nasal wash.
Yeah, who prescribes any drugs to any pregnant woman? That's a brave doctor.
Right.
Crazy one.
Or stupid.
Yeah, or stupid. Good point.
Yes.
So that just ticks to a number, and I guess certain. What about construction workers, people who are in dusty environments all the time? I'm guessing that their mucus is all clogged up.
Yes. And there are dozens of studies in Europe, because in Europe, especially Eastern Europe and Northern Europe, they use nasal washing. And so they have many studies with especially workers, as you say, construction. How about firefighters? How about the military? How about miners? How about farmers? Anybody who works in an environment where they're breathing anything other than pure air, it makes sense to wash. And it's very inexpensive. It's about 5 cents a day. In my NasoPure starter kit, you get the bottle and you get 20 packets of this pre-mixed salt. You add 1 packet in the bottle of water, you drink the water, you put it in your nose, you make your mix up, and you have that for a week. And so for about $20, you get the bottle and 20 salt packets. So it's truly about 5 cents a day, depending on how much you use, which is certainly less than a copay to go visit a doctor.
Well, I'll tell you what, as we come literally to the gun lap portion of the show, I want to make sure that our listeners get that website again real quick, that phone number again, please.
NasoPure, NasoPure.
And the phone number.
Phone number, 877-853-7873. And my cell number, 573-999-0450. And my book is called Clearing the Air, One Nose at a Time, How to Take Care of Your Personal Filter.
What a clinician. Look, folks, we're going to bring it back. We want to talk about vaccines, too. You'll come back, won't you, Doc?
I'd love to.
I'll go wait for you off air. We'll arrange for that. Until then, ladies and gentlemen, we want to thank our guest today, Dr. Hana. She'll be back with us. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.